Here's something most pediatricians won't tell you at a regular checkup. Melanoma in children is rare, but it's been quietly rising over the past few decades. And the single most important thing you can do as a parent takes less than 5 minutes and costs nothing. A mole is simply a cluster of melanocytes, the cells that produce pigment in your skin. Almost every child develops at least a few by the time they're 10 years old. Most are completely harmless. Here's where most parents feel lost. What separates a normal mole from one that needs medical attention? Dermatologists use the ABCDE rule, and you can too. A for asymmetry, if one half doesn't match the other, that's a flag. B for border irregularity, ragged, notched, or blurred edges. C for color variation, multiple shades within one spot. D for diameter, anything over 6 millimeters, about the size of a pencil eraser. And E for evolution, any change in size, shape, or color over time. Moles in children come in two main types. Congenital moles are present at birth. They range from tiny specks to what doctors call giant congenital nevi, which cover large areas. Acquired moles develop during childhood and early teens, largely driven by sun exposure. Both are common. Both are usually harmless, but larger congenital moles do warrant dermatologist monitoring. Let's get specific about warning signs. Watch for moles that change rapidly, in weeks or months, not years. Irregular edges and multiple colors within the same spot. Any mole bigger than 6 millimeters. And while new moles appearing after age 20 are a red flag for adults, in children, any new mole deserves your attention and monitoring. Now let's talk about when you can relax, because raising an anxious child about every freckle helps nobody. Normal moles are symmetrical, evenly colored, and small with smooth borders. They may stay exactly the same for years. Children naturally develop dozens of moles. Having 50 or more by age 18 does slightly elevate lifetime risk, but it's not an emergency. It's a reason for monitoring, not panic. Here's your practical action plan. Check your child's skin thoroughly about every 3 months, good light, fully undressed, head to toe. Use a coin for scale in photos. It helps you track size accurately. Keep a simple photo log. Yes, this takes a few minutes, but it's one of the most valuable habits in skin health. Prevention is genuinely powerful here. Daily broad-spectrum SPF 30 or higher, yes, even on cloudy days. Reapplication every 2 hours during sun exposure. UPF clothing for extended outdoor time. And seeking shade during peak sun hours between 10 a.m. and 4 p.m. These habits reduce melanoma risk meaningfully. For children with many moles or large congenital nevi, some dermatologists recommend starting professional skin checks in early childhood. Ask your pediatrician for a referral if that applies. When should you actually see a dermatologist? Any lesion showing asymmetry, irregular borders, multiple colors, diameter over 6 millimeters, or rapid evolution. Also, if your child has more than 50 moles, a giant congenital nevus, or a family history of melanoma, those warrant professional monitoring from childhood. Let me bust a few myths while we're here. Not every irregular mole is cancer. Most childhood moles with unusual features turn out to be benign. Evolution is the key signal. Spitz nevi, for example, often look alarming under a dermatoscope but are usually harmless. And one more thing, darker skin does not protect children from melanoma. It can actually appear in less obvious places, under nails, on palms, soles, which makes skin checks just as important. Here's your biggest takeaway. The odds are overwhelmingly in your favor. Most childhood moles are entirely normal and will never cause problems. Your job isn't to become a dermatologist, it's to stay aware, protect their skin daily, and know when to ask for a second pair of expert eyes. If this guide helped you, subscribe for more parenting health content like this. Hit like if you found it useful, and drop a comment. What skin or health topics do you want us to tackle next? And find more resources on children's health and safety at Moonbloom.